Hello. So let's start discussing about optic nerve disease. Before this, we will have to discuss about anatomy of optic nerve and some of its physiological part. So coming to anatomy, so if you see the architecture of the nerve and the anatomical subdivisions of the nerve. Okay. So architecture will have optic nerve fibers. One, there are three cells: oligodendrocyte, microglia, and astrocyte. Nerve fibers, three cells, and surrounding sheaths. So optic nerve fibers, there are about 1.2 million optic nerve fibers in the optic nerve. They are arranged in 600 bundles separated by fibrous septae. Hmm. Anything else important here is, yeah, most of the nerve fibers will terminate in the lateral geniculate body and few will terminate in other centers like in the pretectal region. Okay. Um, they will subserve about 5 degree of the central visual field. Then the three cells, oligodendrocytes, they form the myelin sheath. The microglia, they are phagocytic cells. Then they will cause apoptosis of the retinal ganglion cells. Finally, astrocyte. So astrocytes, they lie in the space between the nerve fibers and the other structures. So when there is optic nerve atrophy, they will fill in the space. Then after the three cells, we have got the surrounding sheaths, pia, arachnoid and dura. So pia has got the blood vessels. The outer sheath consists of the arachnoid matter and the dura matter. The subarachnoid space is continuous with the subarachnoid space of the CNS and has the CSF fluid. In optic nerve fenestration, incision is given in the outer sheath, the dura and the arachnoid. Okay. So the nerve fibers, the three cells and the surrounding sheath. Next we come to the anatomical divisions, subdivisions of the optic nerve. 4. Intraocular part, intraorbital, then intracanalicular and intracranial. The intraocular part is the shortest part, about 1 millimeter deep and vertical diameter is 1.5 millimeter. Intraorbital part is 25 to 30 millimeter. Here the nerve is S shape and slack. In the intraorbital part, it extends from the globe to the optic foramen, which is at the orbital apex. Now, at the orbital apex, it is surrounded by fibrous structure, the annulus of Jin. This structure gives rise to origin of the extraocular muscles. The superior rectus and the medial rectus, they originate from the optic nerve sheath itself. Hence, when there is optic neuritis, there is a pain on ocular movement. Now, because this part is not fixed part, so it allows any movement without any stretching of the nerve. The next part is the intracanalicular, inside the optic nerve canal. This is 6 millimeter and is a fixed part because the dura mater is fixed to the periosteum. Finally, intracranial part is about 5 to 16 millimeter, average 10 millimeter. This will join the chiasma. Okay. Next, this was completed the anatomy part. So architecture and anatomical subdivisions. Then exoplasmic transport. It is the movement of the cytoplasmic organelles from the cell body to the synapse. Orthogate is called as if the organelles are moving from the cell body to the synapse, and retrograde from the synapse to cell body. When it is an active mechanism and it requires oxygen and ATP. So when there's hypoxia and toxins, the flow is reduced. So stagnation of the exoplasmic flow will cause accumulation of the cytoplasmic organelles, causing axonal infarct, also known as cotton wool spots. Okay, thank you.